May is Stroke Awareness Month, and there are certain medical conditions that can put you and your loved ones at a higher risk. Joining me today to tell us more is Dr. David Rose. Thank you so much for joining me, David.
My pleasure. How are you?
Good, thank you. All right, tell me a little bit about the importance of Stroke Awareness Month.
Sure. So May is Stroke Awareness Month, and it's important to know if you have risk factors for stroke or if you develop a stroke, what to do and where to go. Certainly the mnemonic is FAST. We all have to know about F-A-S-T. F is for facial droop. A is for arms. Put your arms up. If you have a drift of one of your arms, you could be having a stroke. S is for slurred speech or trouble getting the words out, understanding speech. And T is for time, which means go to the ER immediately if you're developing these signs of stroke, because there are agents we can give you to reverse a stroke from happening.
Okay, and then I understand there's a condition that can increase the likelihood that someone might have a stroke.
Yes, something called atrial fibrillation, which is an irregular heartbeat, an electrical problem in the heart that causes clots to form inside the heart that can flick off and go to the brain, clog up the pipes in the brain, and cause a stroke. And one of these symptoms, the F, A, and S in the FAST mnemonic. So certainly if you or someone you know has atrial fibrillation in the heart, you should consider being on a strong blood thinner like Pradaxa, which is one of the new agents, or warfarin, which is one of the older-timey drugs, to thin the blood enough in order to prevent a stroke from happening in the brain.
So how do I know if I have AFib? Would I know that?
So some of the symptoms of some of the symptoms of AFib is irregular heartbeat, palpating really fast, and not when you're exercising or when you're stressed out like I am being on TV right now, but when you're just doing nothing at home and your heart just starts to beat wildly out of control, you feel lightheaded, about to pass out, something like that. That can be signs of atrial fibrillation. So certainly talk to your doctor, get an EKG, a heart test, a rhythm, electrical test of the heart to see if you have it. And if you do, consider being on a strong blood thinner known as an anticoagulant to prevent strokes from happening in the brain from blood pooling in the heart during this AFib condition.
Okay, so a blood thinner is probably my best bet then for treating this or to lower my risk?
Yes, atrial fibrillation is 5 times more likely to cause a stroke than patients without atrial fibrillation. So being on a blood thinner like Pradaxa or warfarin or one of the other agents that are on the market now can lower the risk significantly. So certainly talk to your doctor if you qualify for these medications to prevent a stroke from happening and lower that risk. If you have high blood pressure, know what your numbers are too. Lower that to 120/80 if you can. Know your cholesterol, lower that if you can. And if you're a smoker, please quit, because that can certainly increase stroke risk, heart attack risk, cancer, and other problems, of course, too. So knowing all of these things are important to controlling your health and preventing seeing me as a stroke doctor and having a stroke.
Right, we want to avoid seeing you, no offense, but where should people go
That's
for
right.
more information if they're interested?
If they're interested, I recommend going to the American Stroke Association, AHA.org. It's a website that has a lot of great information. But just type in the word stroke or atrial fibrillation, and you can certainly find out more online. And know your risk. See your doctor, of course. They're full of information about this, and prevent a stroke from happening.
Dr. Rose, it was great talking with you. Thank you so much.
My pleasure. Thanks for having me.